His Excellency Abdul Rahman Al Awais, the UAE's Minister of Health and Prevention, Her Excellency Peggy Vido, Minister of Health for the Seychelles, Her Excellency Zoe Rapti, Deputy Minister of Health for Mental Health Issues, the Hellenic Republic of Greece, Dr. Maria Van Kerkhoff, the World Health Organization's COVID-19 Technical Lead, and of course your moderator for the session this morning, Caroline Farage, Vice President of CNN. Would we get a round of applause for everyone up here, please? And Caroline is just here. Please be seated.
It is very important to create infrastructure, which means, and this is what we're doing in Greece, to create day centers for children and adolescents, and also for the elderly, for dementia and Alzheimer's, also to create residential areas that people can live in, and also mobile units. Mobile units have been proved to be very helpful, especially to go to remote areas. We used mobile units also for the vaccination of the people, and the vaccination was a factor that helped the mental health, gave a sense of a push to mental health also. And this is the period, in my opinion, that we should fund more the services in mental health. This is a global procedure. It must be a global cooperation. Also, big organizations as WHO and the states should cooperate on that. In Athens, we had and we held the Athens Summit that was created and devoted to mental health. As WHO put it, there is no health without mental health. So it's our priority to augment the funds that are being given to mental health, and we augmented it by 62%. And also, what we are trying to do in Greece is to create more infrastructure. And we must see COVID-19 pandemic as an opportunity to ameliorate our services, to give services and give also data to the people, because we know that stigma is a paradox that don't help record all the victims of suffering with mental health, and also to create new digital tools to help with the mental health services. Also, it is very important to create infrastructure, which means, and this is what we're doing in Greece, to create, last but not least, it was also our effort to give special care to children. As we saw, the pandemic struck children most of all. The lockdown was a very stressful period also for the general population, and it created also anxiety, it created panic attacks, it created special visits at the emergency units of the hospitals, and also for the elderly, because they were, and those who were working. Those who worked at home had also big problems that had to do with family conflicts. They were all together, and we had to give also special help to them. So that was why we created this portfolio, and in order to address the problem with the addictions, because during COVID-19 we saw also a rise in addictions. We saw extensive use of the internet, and many of our children and young people were really into them, having also big problems with also cyberbullying and other certain factors that devaluated their health.